You may be surprised by this next statistic, but 1 in every 200 Americans suffer from inflammatory bowel disease. This digestive disease can be very painful, and even though there isn't a cure, it is treatable with the right medical care. Joining me today are Eric Pollack and Kevin Harlen, the COO of Capital Digestive Care and the Take Steps Walk Chair. Gentlemen, thank you both for being here. This is a big week because Saturday is leading up to this Take Steps Walk, which is going on in the National Mall on Saturday. And as I said, the weather is going to be pretty good.
I noticed in your lobby, actually, it's 81 and sunny anticipated on
Keeping
Saturday.
tabs on that one,
Absolutely.
keeping tabs on that one. You know, when we talk about bowel diseases, it's very hard for people to be candid because sometimes it's embarrassing. You probably get that from people you work with, that, you know, there's a lot of people out there that are dealing with it, but it's hard to find someone to talk to about it.
Yes, very much so. This is an embarrassing area of the body for a lot of people, and embarrassing condition.
And what is really, I mean, I know it's hard to know what is causing this, but some of the stats show that people are dealing with this disease when they're younger.
Right.
Teenagers, early 20s?
Right. The peak incidence is between 15 and 35, and there's a second peak after 50, but it can affect anyone of any age, but the major peak is that 15 to 35, so younger people.
And the good thing is people can deal with it. We don't have a cure. And how are people dealing with it? To be able to work, to be able to, you know, be social.
Right. Almost every patient can have the disease put in remission with the drugs we have now and deal with it. It used to be much harder to treat in the past, but in the last 10 years especially, there's a lot of new therapies that are very helpful.
That's good to hear. Let's talk about the walk, which helps a lot of people, not just with IBS, but with Crohn's disease. And there are a lot of people, not just here in D.C., but all over the nation that suffer from this.
Well, there are many suffering silently, unfortunately, and the walk is an opportunity to walk and be heard. And we anticipate approximately 1,000, hopefully more, participants on the walk. Folks still have the opportunity to come. You don't have to pre-register necessarily. Come to 15th and Constitution on Saturday the 16th at 4:30 and join us. There's lots of fun activities for families and kids and so forth. And I know you were there last year. Thank you for your support.
It was a great day last year. I think you guys are just good at picking good days.
It was terrific. And we're on track to meet our goal this year from a fundraising standpoint, which is so very, very important to find a cure to these diseases.
It is. I talked a lot about on this show that my mom has Crohn's disease. That's why I'm involved with CCFA, and it's been something in our family that we've dealt with since I was a teenager. And the most frustrating part is you don't know what's causing this, and the research, there isn't, even though there's money coming in, there's not as much as other diseases. You know, a lot of times the big walks on the National Mall are, of course, breast cancer, which they need everything they can get as well. But with Crohn's disease, I think a lot of people go, well, I've heard of that, what is that? And these walks are so important because we can get that research money so more people know about it, and we know what's happening within our bodies.
Well, it's important to note that the National Capital Region Walk last year was the second most successful in the country.
That's awesome.
Unfortunately, right behind Philadelphia. So for the Redskin fans, let's get them this year.
Yeah, exactly.
And be the #1 successful walk. Our company, very proud to report, was the leading team nationally last year in terms of amounts raised. So we're very proud of that.
That is very good, and congratulations
Thank
on
you.
that. Let's move back to symptoms. If someone's hearing IBS and Crohn's, what are the leading symptoms if somebody thinks, gosh, you know, I thought maybe I've had that, or do I?
Right, so IBS is often confused with IBD, but there are two different conditions. IBS is irritable bowel syndrome, and IBD is inflammatory bowel disease. And they can present in very similar ways, and it can be confusing. There's two kinds of inflammatory bowel disease. There's ulcerative colitis and Crohn's disease. Ulcerative colitis usually has diarrhea, often bloody diarrhea. Crohn's disease has diarrhea, abdominal pain, fatigue, and weight loss as the major symptoms. And if you have any of those symptoms or you're concerned about it, I would definitely go to a doctor to get checked out. There's a number of blood tests and other tests that can be done to make the diagnosis.
Don't let it go on. Don't try to self-diagnose. Go out there and get screened, which is so important.
Correct.
Well, once again, the big walk is this Saturday on the National Mall, 4:30?
4:30 registration. Walk will start at about 5:30. It's less than 3 miles around the tidal basin. Weather's going to be fantastic, and we hope for a very successful walk.
There you go. Well, thank you, gentlemen, for being here. I appreciate it.
Thank you.